So tonight we're very lucky to have Dr. Joan Horton present. And she is going to present on Strive, simulated training for resilience in various environments. This is a course that teaches mindfulness-based stress management tactics to deal with acute stress and cope after traumatic events. The evening will include a practice of several of the big 4+ techniques, which include goal setting, visualization, self-talk, progressive muscular relaxation, attention control, and tactical breathing. So Joan is a semi-retired, she hasn't learned the value of full retirement yet, semi-retired family doctor. And she was a teacher and examiner of the medical students, and she works for the College of Physicians and Surgeons, evaluating medical practice of her colleagues. She had a diverse experience in practice, including family practice, women's health clinics, HIV clinic, and CUPS. She started her mindfulness in 2009 and got a master's in research in mindfulness and was the resident wellness chair for postgraduate medical education for 2 years. So Joan collaborated with initially a medical student, Stephanie Smith, who was a captain in the armed forces and wanted to bring the Army's resiliency tools to medicine. And therefore they created this Strive program. So I think this is going to be a wonderful evening. We're going to learn something new. And with that, I'm going to turn this evening over to Joan.
Hello, everybody, and thank you for coming. This is the best turnout that we could imagine, and I hope that it is a successful evening for you coming here and investing your time, that you walk out of here with some useful skills that you can implement when you find yourself in a stressful situation and even after a stressful situation. So the journey to this, of course, is a long journey when anyone gets to this level. I began with mindfulness being given to me, John Kabat-Zinn's Full Catastrophe Living in 2009, and becoming resident wellness chair and realizing that medical education had nothing in it to help people cope with the stress of practice. I mean, that might not be unique to medicine, but it certainly seems to be a huge chasm. And so I started to, and that's how I got to be the resident wellness chair, because I thought that I could bring something. And I developed a workshop for residents, and it introduced them to mindfulness. And also HeartMath. Junie, who's here, she has given a talk for us before about HeartMath, which is a biofeedback device that you help tap into your cardiac coherence. And so I helped try to educate people's eyes, residents' eyes, to this. And that led to me being involved in updating the Well Physician course in undergraduate medical education. And through being a preceptor for a small group, I met this very talkative woman who always had something to say, very educated, knew exactly what she was talking about. And that was Captain Stephanie Smith, an older medical student who has been an emergency nurse in disaster situations, who had done the Canadian Armed Forces Road to Mental Readiness program, and thought, why is this not in medicine? How could it not be that we offer it to first responders, we offer it to nurses, we offer it to soldiers? Why are not doctors and trainees in medicine learning this skill? And so Stephanie and I collaborated and ran it through a couple of iterations with medical students. And then we applied and got research funding from a number of sources, including the Canadian Medical Association, to run it for 2 different classes of medical students. We had 40 to 45 students, and they would come for a 4-hour workshop. And the workshop consisted of 2 hours of didactic training where we taught them and gave them some a little bit experience, so experiential learning about the 6 skills in the big 4+ that are the clinical skills that are on the road to mental readiness. And we talked to them about the mental health continuum. And I wanted to show you how this has all evolved. there's these little things that I don't know if you can appreciate this very much. See that little red, see that little line there, green to red? That's the mental health continuum. And the Canadian Mental Health Association has incorporated it. And the Resident Docs of Canada has also incorporated it. So what we started was all part of an action to bring these kinds of skills where you recognize how stressed you are based upon different symptoms. And it breaks it down. If you're green, you know, everything's kosher, but if you're red, you're irritated, you're not sleeping, you're wanting to have extra drinks, those sorts of things, and gives you some ideas also about what steps to take next. And then there was lots of resources. So we worked together to try to help bring this to the medical school. And in this study, we actually published that study and in 2021 in the Canadian Medical Education Journal. And we've taken it to the International Conference on Physician Health, to presented it at conferences across Canada with a lot of residency programs here in town and elsewhere. And I really, I hope that we can go through those 6 skills, and we're going to do experiential time in 4 of the 6. And so let me talk more about this Big 4 framework. So we know that there's really realistic stressful situations that everybody's going to encounter, like nurses, first responders, and social workers. And we wanted to aim at equipping clinicians and people in the first response sort of field with a whole set of skills that they could use to help optimize their response in that stressful situation and help them see a road to recovery following those very critically stressful incidents. And if you can do that, we know there's a lot of burnout amongst medical students. About 50% of medical students are burned out before they become residents, and then it escalates in residency. And one of the problems with healthcare these days is so many physicians are highly burned out, and of course nurses. So we know that we need to help people offer these skills. So we need to reduce burnout so that people can maintain their efficacy and remain connected to people and not become cynical and feel that there's no worth in their work. We need them to be able to feel that it's worthwhile and that they can then enhance their resilience so they continue to have a long practice life. So I am losing my pages here. So I talked to you already about the research and where we've done it in many different settings. And so tonight is the first time that we've actually brought it to a group like this. I usually have a big PowerPoint, I usually have handouts to give people, but we don't do that here. We're going to just try and share some of the thoughts and the skills with you. So first, the goals for tonight, I'm going to explain the Big 4 plus skills, and we're going to practice several of the skills. One of the key things that we learned to incorporate in our study that is not done enough in medical training is to do a debrief, to check in after every event and ask people how it felt, what emotions they felt, just everything about it. So we really break it down, and that's where your part's going to be. We're going to go through these experiences. You're going to give me feedback about your check-in, and then we're going to hopefully we'll talk about some scenarios maybe in the Q&A about things that a stressful scenario where you might wonder how you could apply these skills. So the first skill that we're going to talk about is a practice that we're going to do now called arousal reduction, or it's also known as tactical breathing. You may recognize it by the label of box breathing. And so the reason that we learn to practice this skill is that you can reset your sympathetic and autonomic nervous system very quickly if you learn to practice this skill. By taking a deep breath in, you activate your diaphragm, which helps stimulate your vagus nerve, which helps slow your heart rate and slow your stress response. And so by using box breathing and taking that deep breath and holding it in, and then breathing out slowly and holding the exhale, you really override that sympathetic response of the fight or flight reflex, and helps you be able to remain in control, remain calm, remain aware of what's going on around you so that you can cope better in the midst of this very stressful situation that you're in. Has anybody done box breathing before? Thanks, lots. There are variations on a theme. Some people can't do the box breathing because it's too slow. The breathing is like a 16-second cycle, and that can be difficult for them. So if you feel like that's just too long for you and your breath, you may do whatever works for you. The key part to it is the slow exhale and the long time between the breaths. So if you have to breathe in and you can't hold it for the 4 seconds at the top and you need to initiate your exhale before, by all means do. And if you can't hold it out for that long, by all means start your breath in. So I'll walk us through a 16 count, but you're welcome to do what appeases, what fits your physiology, okay? And hopefully we won't have too many of these little kids. But imagine this is a stressful ER and you are having all these shouting voices and you need to be able to regain some calm. So in order for this to work, we need to do it for about 4 minutes. So I thought I would set a timer. Get yourself comfortable. And we will do box breathing or tactical breathing, however you want to do. So at least 4 minutes. So I might actually set the timer for 5, just so that we can, by the time I walk you through it, because I'll only walk you through a certain number to count you in. And then I invite us all to practice until the timer goes, if that's okay. And then we'll debrief, check in after that. Any questions before we start? All right. So we're going to, let me walk you through a little bit more of a description. You're going to try and breathe in slowly. It doesn't matter to me whether it's through your mouth or your nose. See if you become more relaxed while you're doing it. And be sure to breathe gently and slowly if you can't. And if you feel dizzy, by all means, take it as a signal that you're breathing too fast. Or if you're feeling lightheaded, then maybe you're breathing too slowly. So you're doing fine if you can slow your breathing down to around 4 breaths a minute, if you can. So no reason for you to not do what you need to do. So let's practice it for 4. So as you want, sitting calmly, eyes opened or closed, whatever you prefer. Center yourself and I'll walk us through. We're going to breathe in slowly for the count of 1, 2, 3, 4. We're going to hold for 1, 2, 3, 4. We're going to breathe out for 1, 2, 3, 4, and hold for 1, 2, 3, 4. In, 2, 3, 4. Hold, 2, 3, 4. Out, 2, 3, 4. Hold, 2, 3, 4. In, 2, 3, 4. Hold, 2, 3, 4. Out, 2, 3, 4. Hold, 2, 3, 4. In, hold, out, hold. In, hold, out, hold. Carry on your own, at your own pace. We've been practicing for about 4 minutes now. So when you're ready, let your breathing return to normal pace. And open your eyes. And let's discuss. Well, I'd like to find out how that went for you. Would anybody like to share how that they felt while they were doing that breathing? Yes. Go ahead, sorry. Yeah, you. Yeah.
Can see where your eyes
I know, I have a lazy eye, so.
That's all right.
this
This question that he asked.
Oh, yeah, okay. Thank you, you.
Yeah. I noticed that I was more aware of whatever I was feeling inside my chest, whether it was an anxiety or something, but it was more pronounced on separate my feeling.
Yeah, so while you were breathing, your anxiety within your chest became more pronounced?
Yeah. I don't want to say it'd make it worse. It's just I felt it more like it was separate from actually feeling it.
Mhm.
Felt it inside itself, but it became more prevalent. I'm more aware of it singularly.
That's an interesting response. Was that upsetting in any way?
No, it was just, I mean, I could have made it feel upsetting, I suppose, so it's just interesting, so I'm curious about it.
Okay, thank you for sharing that. Anybody else?
I felt something too within, and I wondered if it was like my pulse or my heart I was feeling. Not sure, but I could really sense that.
Did anyone else feel that?
Yes.
So there's some calmness for people when you still yourself and you really focus on your breathing, you become much more aware of the rhythm of your heart. Deb, you had a question?
When I do breathing, I can really pay attention. I start appreciating, noticing my body and realizing where I'm holding tension that I don't need to. Need breath to release. But so that's.
So using box breathing helped you relax the tension that you could feel within your body.
I've used breath in the past to just really sort of focus on and realize where I'm holding and using, using parasympathetic breathing, but really being able to, and I really pay attention to it, and a good consistent, just really noticing and being able to use breath to really release pain. I have muscular sclerosis,
So using your breath is a powerful tool that you can bring your breath to focus on the areas where you're holding pain or tension.
Yeah.
And you said called it parasympathetic breathing. That's an interesting
well, I
thing.
hadn't said that, but that's it, it is.
So it's interesting, it's got many names for the same idea. And it can help in that way, just slow things down. Anyone else? Yes.
I used this last night actually, but just to slow down repetitive thoughts or too many spiraling thoughts.
Mm-hmm.
But my question is, how long or what's the right duration for box breathing to make it effective?
They recommend, the military did research on this, and they recommend that the practice is at least 4 minutes.
Okay.
In order to drill
calming.
in the calming reflex.
Okay.
Once you become accustomed to it,
Yeah.
it's like dropping into a meditation, and you can drop into that sense of calm and bringing your breath to focus on the points or whatever, and using it to still. And so it becomes when we were doing this training, we were doing it, for instance, with residents in training, one of the senior surgical fellows said, when I'm in the midst of an OR and something's gone wrong, I will take a couple of box breaths. Or not necessarily gone wrong, but he's worried about something going wrong. He'll step and think, and that he'll use that as a skill to be able to center himself and refocus.
Okay, so you practice it for longer periods so that in those stressful moments you can drop into it. Because I was going to say, I have 2 small kids. I can't imagine being like, I need 4 minutes.
2 small kids, you're right. Good luck at funny 4 minutes in the bathroom.
5 to 10, actually.
Yeah. Yeah, so that's good. Is there any thoughts that went through your head? Is there anyone that found it too slow? Yes, sir.
I've done box breathing before, and this is what I experienced tonight also. Um, on the full, everything's fine. Oxygen and carbon dioxide are exchanging, no worries. Gently down, and now I'm empty, completely empty. And it's like doing an emergency ascent, scuba diving. I don't think I'm gonna make it. I don't think I'm gonna make it. Shit, I'm not gonna make it. And then after about 8 reps, I'm down there, I'm laying on the bottom, completely empty. It's good.
That's a fascinating thing. I don't know if I can encapsulate that for the sake of the people potentially, but your body becomes accustomed to that deoxygenated state, and you learn it's only temporary at the bottom.
It's stressful.
Stressful at first, but you become
Being at the
acclimatized.
bottom is, it is creating its own stress. Then back up. Oh, this is nice. Down.
Mhm. That's a very powerful picture.
This is less
Thank you.
stressful, and as that stress is leaking out, so is the reason why I'm doing it.
Yes.
I find that interesting that you say that, because I find for myself that to sort of calm things down, I need to take a number of very deep diaphragmatic breaths with long exhales. But box breathing, whenever I've done it, it's sort of increased the stress because of the hold part.
Mhm.
And maybe even more of the hold after you've emptied your breath. And so I have found in stressful times and non-stressful times, my stress has sort of increased a little bit with the holding of the breath.
Absolutely, it could. If you have any element, and I'm not saying that you do, but if you have any reason that your oxygen level might not be full, like you had, say, asthma or COPD or something else, where you really didn't have the same lung capacity, you might have more of a stressful experience there. And that's why you can change it. That's why it doesn't have to be like that. Do you know Andrew Weil? He's an integration medical specialist, and he pushes for, well, his variation on this is a 7 to 8 second exhale instead of the hold.
Yes, and that's why I did find this one better tonight, because I've always only done the longer holds.
So you take this skill, can you see using it, whether it's a standard box or a prolonged exhale? Are there times where you could see when the kids are driving you crazy potentially? Is there other times in your life where you could see employing this skill? How about at a red light when you're late in traffic? Anybody? Oh, you were going to say that? I read your mind.
When I'm overwhelmed, it's kind of an example of that. But yeah, I work a very stressful job, and sometimes it just feels like all too much, and like you're just gonna break in that moment. And sometimes that's kind of when I'm like, what can I do to step back from this and bring everything back into perspective? And I feel like that would help kind of hone in on that and kind of separate yourself from that anxiety and that overwhelmed feeling in that moment.
Mm-hmm. Okay.
I used to just use red lights as an opportunity. I'd forgotten that, but I used to, I used to just use red lights as an opportunity.
Mm-hmm.
Well, you know.
Yes. Oh, yes.
I noticed that it took probably about halfway through before I actually could feel my diaphragm moving. So the value of extending that 4 minutes or beyond, I think, like it took me that long just to get to the point where I'm like, oh yeah, now my diaphragm is moving and this feels different.
Mm-hmm.
Yeah.
So that's some wisdom that we're sharing, is that it's a learned skill to really be able to feel it, but once it's learned, you've got it. And it's a learned skill to become emotionally comfortable potentially with that low air feeling, or to adapt it to so that it doesn't exacerbate any stress, and to have it be that sort of reprieve. So
It's important to hold the empathy. There's something about that part of it that's really important.
provided you can, right? Provided you can, because it's, for some people, it may not be possible.
So would you suggest that maybe this is a practice, probably don't recognize how anxious we normally are. And we think, oh my God, this is a stressful time, the kids want this. But I think we often go through life with this degree of anxiety. So should we do this every time we can?
Anytime you can, when you're brushing your teeth. No, no, not necessarily. I'm going to do one that's more didactic, and then we're going to do another practice. So one of the things, the skill sets that we talk about in the Big 4+ is goal setting. And goal setting is uses the acronym SMART. And it's very straightforward in that, has anybody heard of that, SMART goal setting?
Yeah.
Okay, so I'm teaching the converted here. This is what's going on. I'm just looking for the right page because I got a number of extraneous pages going on here. And so goal setting is one of those things that I never really knew about that until I kind of did this. And so the S stands for specific. And that means you guys are going to do this, so it needs to be clear what you want to accomplish. And especially a kind of behavior that you want to take, like it's only yourself, it's very personal. What's the M for? Measurable, really good. Goals have to include something kind of concrete criteria that you want to measure the progress towards attainment of the goal. And you want to kind of be able to quantify the result. How much or how many, and you have to be able to see that progress as you go, whether it's days you want to do something for, you've got to somehow be able to see it, quantitate it. What's the A stand for? Attainable, right? And so it has to be attainable and realistic, something that you're really going to be able to do. It's a major stumbling block for a lot of people because they set their, such a high standard or hope for themselves, and then they don't achieve it, and then it's hard to sort of think about going forward again with another goal. So longer term goals are harder to work with. So creating a short-term goal that is a smaller piece of that you can chew it down to, that you know you're going to be able to digest, to complete in time. That's attainable. It also lessens the anxiety if you have any issues with achieving that performance. So more manageable targets that are attainable. The R in SMART stands for realistic or relevant. So it needs to be realistic or relevant, like it's going to be something that really matters to you, that really motivates you to do. Desirable or necessary. Ask yourself, why is it important? And so you have a clear understanding of why you want to undertake this goal. And how is it important? Like, what is the pros of you doing it? What are the cons of you doing it? How is it going to make you feel at the end of, especially if you experience any setbacks in achieving the goal, so that you have to really want it or need it. And the T stands for time bound. So we need to ground ourselves in some sort of a time frame. So when will we be able to complete the goal? Next week, in a month, in a year? And oftentimes people miss the time element when they're setting a goal. They don't set a firm date. So that decreases the likelihood that you'll achieve it. So if you make yourself a SMART goal that is specific, measurable, attainable, relevant, and time bound, you might have a better chance of achieving that goal. Sometimes when you're under a lot of stress, it's really important to note that there can be a change in the goal setting. You have to think about what's important now. And that WIN acronym is especially useful when you're under a lot of stress in a clinical situation. What's the next most important step? What do I have to do? Or what needs to be done for my patient or my colleague or my family member or my child? So you have to ask yourself, what's the very next thing that needs to be done? What's important now? And when you do that, you focus on the next small step that you have to attain, and it's necessary within the next time frame. And it helps us to prioritize our efforts and things we might feel threatened by. And so an example of this might be shifting from, like, imagine if you're in that emergency with a lot of noise and you have a lot of things going on around, but somebody comes in and you need to go to that person because they're having a heart attack and they need to be intubated right that minute. So you can realize that this is all going around you, but you realize the next most important goal is I need to start code on this person and intubate that person. I mean, there's other examples. I have lots of other goals that I've set, and my most important goal is I'm going to have a dry January. So I've never done that before. I don't know if anybody else is gonna do that, but my trainer said, do you want to do that with me? I said, sure, I'll try it. So it's SMART. Everybody says alcohol is not good for you, more than 2 drinks a week. It's, let's go with the acronym. It's measurable, 31 days, and it's attainable, and it's relevant, and I've got a month. And it's like people do all kinds of things for a month. I've never done anything like that before. Does anybody else have any SMART goals that they would like to share? Yes.
I was gonna ask a question. I had a practitioner once that we tried to do box breathing, and they had kind of set the goal, I suppose, that I should be practicing it 18 times a day. And I think for me, that didn't work. And I guess like when we go through the SMART goal definition, like attainable, I suppose, is more relevant for me, as to maybe where that went south of something, because she had said that in order for something to become, yes, thank you, you have to be able to, you have to basically be practicing it that many times per day. And so would you just recommend kind of breaking it down and starting with smaller, more attainable SMART goals and then building on that in order to make box breathing a more habitual thing?
I've never heard anyone suggest that you need to do it 18 times a day. Is that something that anybody else has heard?
So I was told to set timers in my phone, and she's a more neurodiverse specific person, so I'm not sure if that has anything to do with it, but yeah, and I found the alarm situation very triggering, having that many alarms going off throughout the day. Doesn't bode well for stress levels for me personally. And so I was just kind of curious.
Well, I think the general consensus is that 18's a lot.
Okay.
And is it realistic? And the R is realistic and relevant. Is it realistic to stop everything that you're doing and practice? What would be manageable? What would really be smart for you in your life? What can you do that you have the time to be able to do it, where you're going to feel comfortable doing it, and it's not going to make you more anxious about not doing it?
And that's, I think, where I got to with it, was that I was starting to feel more anxious about the fact that I was dropping the ball on doing it, and that I was feeling like I wasn't meeting this goal, and just, yeah.
Exactly what I was talking about.
Negative feedback loop, basically.
Yeah. So,
Set up for failure.
Yeah, that's kind of, yeah, exactly.
yeah. Anybody else? Yes.
I want to go back to the M and the T. On day 17, how do you know that you're likely to make it at day 31?
Yeah, good question.
And the measurable and the time bound are important to have the little milestones, so that halfway, a quarter of the way, you know that you are on the right track and likely to make it. To say at the end of 31 days, I'm just emphasizing the M and the T. They need to be short increments.
Well, I think a week might be a start, 2 weeks, and I think I'll congratulate myself for anything beyond that, because like many doctors, it's not uncommon to have a glass of wine at the end of the day to unwind and to be able to go through your life and not have that crutch. And it's good. And so I feel that I also have my trainer. It's a challenge, and I work with her twice a week. So I have a partner, and that helps. Just like anybody going to, say, AA, where they have a sponsor and you attend the meetings and you develop some sort of community and support, I think that helps it be measurable. And it's also somebody, if you don't attain the goal, will commiserate with you, that it was a lofty aim and you did your best, you tried, but maybe next time.
And when you're going toward goals, if you don't get there exactly, you got a long way toward them. That's really something to congratulate yourself for.
I've counseled smokers, and that having had 2 parents who were smoking and a dad who died of lung cancer, that is kind of one of my things. I helped so many people in my practice quit smoking. And smoking is as addictive as anything else. And it was every single small step that you succeeded in quitting anything was worthwhile. Yeah. And somebody else had a hand. Anybody else have any goals they'd like to share?
I do a goal a month, it's just something that I do. And I think I probably started small and attainable, but then that success builds upon itself, so then next time I can bite off a little bit more, and then I can do a little bit more, so you get then the confidence in what you're doing.
It can be short. It can be a goal for the next hour. I'm not going to check my phone.
Absolutely.
I'm going to turn my phone off at, I just read something, nothing good happens on your phone after 8 o'clock. So it's like, okay, so shutting your, I mean, there's so many ways you can set a smart, attainable goal. Anybody else have anything they have made as a resolution?
Or try building like a morning routine, something that I kind of just haphazard throughout my entire life, trying to restructure mindfulness for the day. I decided to kind of just start with my day where I have some sort of routine and follow through, but also have the ability to pivot. So sometimes I can't do something or something comes up, but I would normally beat myself up saying I will not my entire day's off because B did not work out. Right? But I found out how to adapt to it. And I find that, as the gentleman down there was saying, small increments of raises that I was able to still achieve, going through helped a lot.
So I have forgotten to reiterate this for the people, but breaking something down into small increments has helped you achieve more towards affecting these changes.
Yeah. Smaller goals help bring the bigger goals.
Smaller goals help bring the bigger goals. Well said. Anyone else would like to? Yes, sir.
I find financial goals, I make goals, I like to make goals, but I find financial goals stressful because I want to pay my mortgage off or whatever it might be, and then your car breaks down and you need to put, so it's things you don't have any control over, but you want to make these goals, it's important to you. I just speak out first person, they're important to me, but things happen completely outside of my control, so I never know what to do with that.
That's a big question. I don't know that I have any answer for you, because I think that's a common part of the sort of the human condition, that we all have things that we'd like to achieve. But what this talk focuses on, what to do that's a small, attainable, realistic goal that you could work, that would chip at it, that would knock a bit off of that large goal. How could you change your spending or your outlay a little bit in order, for you to achieve the mortgage payoff that you want? Like so trying to break a big attainable goal down into small steps that you think you can attain, so that you can also give yourself a pat on the back for having attained them. It helps you feel like you're doing better. It helps you feel prouder of yourself when you accomplish something small towards your ultimate goal. And to me, like, that's the positive mind frame that I think people need to have because it is stressful. But if you can see yourself making some small habit or change every day that helps you cope with that bigger, huge mountain of debt that you want to pay off, that's part of the goal of this. I mean, yeah, I hope I've tried to answer that. Yes.
My experience of SMART goals is in a management kind of setting, in which there's also management systems, which has a cycle of always taking in the monitoring of what's going on, because we have measurable goals, you're measuring something, so then you track it, and you have a potential feedback loop, and to constantly reevaluate whether the goal you've set is in fact realistic, because it may be realistic at one point in time, and then later on, it may no longer be realistic. And then it becomes maybe not attainable, and so you reassess constantly.
Yeah,
so you adjust it. So, I didn't succeed at dry January, because halfway through I had a drink or something. Well, that's okay. Like maybe it was dry January, it's a one drink in January, that's it. And the next 2 weeks, I'm going dry again. Right?
Exactly.
Whatever.
So I like that, and if I
think
could
that there's an
summarize,
element of when it's personal stuff, in a more corporate world, you can't control stuff like this, so you better just deal with it. At a personal level, though, there's the emotional element that we bring onto ourselves. Not feeling guilty, I didn't make my goal. It's like, so to me, that ties into a compassion part too.
yes, you're right, and that's, we're not talking about self-compassion, but that is also part of the whole mindfulness, is to realize that maybe what we set out to do, we have to readjust and reevaluate our goal and revamp it, and also give ourselves, understanding, compassion if we don't achieve it, but to reset ourselves, to be able to pick ourselves back up and say, well, I can try again. It's okay, and not to think poorly of ourselves because we didn't achieve that, but to think, no, I have the capacity to reset my goal. I can set it again and I can try again. And so that's really important to help with managing stressful events, is that to realize we have to learn from mistakes every time we try. If at first you don't succeed, try and try again, that kind of thing. So thank you for your very, very effective sharing. I really appreciate that. Along the next one that I'd like to talk before we do another example is about self-talk. So this, again, is what ties into what we were just talking about. Learning to send yourself positive messages that are empowering, that help you when things are going tough and you're maybe not performing as well as you want to, or there's things that have occurred, or there's a big thing to do and you're not sure you can cope with it, and you're capable of it. And so that, of course, for people in medical school or people doing their first surgery, like, it fits, but in other walks of life, the first time that an EMS person has to respond to a call, or a social worker has to deal with a acutely suicidal person, or any first responders, where you really have to be able to sort of take it on and own it. And I think in more personal ways, you probably can come up with examples in your own life where there are high stakes situations where you need to be able to do it, and you need to be able to send yourself positive messages to override the inherent negative ones that tend to mill around inside, that I can't do it. So self-talk is important. You have to watch for the negative messages, and then you have to replace those negative messages. And one of the ways to do that is with more positive thoughts. And by asking yourself and answering some questions, you can actually create these positive thoughts, such as, what's the evidence that supports or doesn't support my thinking? Am I certain or am I guessing? Well, I can't do that but I'm just guessing. I've never tried, so maybe I can do it. Am I 100% sure that that's going to happen? Or is that just my fears talking? And if you're not 100% sure, then maybe you might. How many times has this happened before? Well, maybe it's never happened before. So what are you worried about? If it did happen, could I cope? Well, most of us are here, we've coped with a ton of stuff. Yes, we could cope. What would I tell a friend in the same situation? You can do it. You can try it. It's okay. Give it a chance. What would a friend tell me in this situation? Yeah, give it a go. It's okay. I've got your back. I'm going to be behind you. So positive self-talk is composed of phrases to help you keep on track and work through challenges. And they really kind of help you get psyched up and ready to take on the challenge. And they can also help you calm down and center yourself. So you can purposely generate a list of positive thoughts to replace these negative thoughts in such phrases like, I can do this. Say that to yourself. Think about something you want to do tomorrow and Monday. I can do that. Oh, I'm prepared to do that. I'm prepared for this. I can stay calm and I can do that. So the short phrases, I can do this, I am prepared for this, stay calm. And there's any number of positive words or phrases that you can do for yourself that are, your own sort of innate trigger. So what do you think about that skill? Has anybody used that skill deliberately? Would you like to share?
I was just gonna, I don't know if anyone else's hand is up. I love it. It's something, I feel like for the longest time, I personally, and maybe other people share with it, didn't recognize the negative self-talk that was happening, like didn't even know to stop and replace it. So it was like it was almost when you pointed out that those negative thoughts or that negative self-talk was happening. And I remember a therapist at some point had said, would you be your own friend? Like if you were to think about how you speak to yourself, would you want to be friends with that person? So anyway, my point here is, I love it, it's a practice I use, but it took me a long time in my life to even recognize that there wasn't positive thoughts happening.
Anyone else? Yes.
The point that you made about, is this evidence-based or is this conjecture? That's a really.
Is there evidence to support that,
Mhm.
or am I just imagining it? Yes.
And
Yeah,
some
so
of this, the positive and brief things that I do is I just take a little bit of distance and I put on my Mona Lisa smile, right? Completely neutral.
I wish you could see him do this.
I'm not self-taught. I am hearing somebody doing that self-talk, and I'm at a distance from it. I'm observing it, and I'm neutral about it, and well.
You've been through this course before. Because you've that putting on a Mona Lisa file and stepping back and having a broader perspective is another one of the skills. But I didn't ever describe it like that, but that's the ability to develop a sense of space and equanimity from the event.
You're welcome.
That's the sixth, and I'm just watching our time, and so we're not going to talk I'm not going to talk to you very much about that sixth sense, but that is, it's perspective taking, being able to be in the here and now, but being able to step out and see the global picture so that you can be aware of that situation. Like, what are the kids getting up to out in the kitchen while I'm in my bath tub, for instance? Just that kind of sense, or use the evidence in the ER when the kids are making noises, like being able to be aware in the moment with all of that soup going on around you. So being able to take your perspective and being aware that you're being aware, or being aware that you're stepping back, like trying to have here and now in the short, or deep and further back, a longer view. We're not going to do any exercise on that because it's actually 5 to 8. And the one I wanted to finish with was the one I found in my life to be the visualization. I have found that ever since I was a kid, my dad gave me this thing called The Power of Alpha Thinking. It was a book that talked about, Edgar Cayce wrote it. Is he? No, and it talked about going down and getting into alpha thinking state and doing a mental imagery to find yourself in a safe, comfortable environment where you could calm yourself. And so that's where I first, and so it dovetails into meditation, because in many ways, this is an aspect of meditation. It might not be true meditation, but it is guided imagery in a visualization exercise. That is what we're going to do here. Visualization is being used by so many people. Michael Phelps used it to envision winning his Olympic medals. Surgeons use it to envision being able to open up somebody and find what they're looking for. And I used visualization a lot when I was delivering babies. I delivered hundreds of babies when I was doing obstetrics. And this one story where I really was happy, I had visualized what to do with what's called a shoulder dystocia. When you have a really big baby whose shoulder, when they're coming out, gets caught underneath the mom's pubic bone. And you have to be able to corkscrew that baby out and not break their clavicle or rip the nerves in the neck. So I hope I'm not grossing anybody out. So I had this woman, it was her 4th baby. She'd had 3 babies, they were 7, 8 pounds, no problem. So we're in the birthing room at the Foothills Hospital. This is a different husband though. He's 6'4", she's 5'6". Yeah, you're a bit big for pregnancy, no problem. She delivers this baby in the birthing room and out pops his head and then nothing's coming. That baby is stuck. But I had visualized how to do the corkscrew, how to move the baby, how to twist it around so I could bring that upper shoulder out and corkscrew around and bring the other shoulder out, and out comes this 11-pound baby boy. And there was it was a miracle. But I have to tell you, if I hadn't visualized and in my mind practiced that maneuver dozens of times, I would never have been able to do it. So the power of visualization is phenomenal. It can help you jump higher, run faster, swim faster. It can help you get through really stressful times and deliver a baby without anything happening to it. Just a healthy little boy. So visualization is a tool, and I want to share with you that it's one that I found on the Veteran Affairs. And part of the people that really need some of these skill sets that we're talking about are people who have PTSD, who have been veterans, or firemen, or any other first responders, or policemen, where they find terrible things and they have to be able to learn to drive their mind to a positive place where they feel safe and comfortable, and they can build imagery to help override some of the terrible things that they've seen. So Veterans Affairs provided this visual guided imagery that I'm going to do a visualization with you. It's important that you be in a comfortable place where you feel physically safe and secure to do this, because you really are going to go deep into this imagery. I've used something like this when I was doing medical procedures without anesthesia on people, like putting IUDs in my patients. I've used this kind of guided imagery for people to be able to create a safe place where they would tell me all about it while I was conducting the procedure, and it would help take their mind off of what was happening in their body. So it's been used in many ways in medicine. And this is one way that I would hope that we would be able to help you. So mental rehearsal, we've talked about, contingency planning, like with the shoulder thing, and relaxation, like I did with the alpha thinking. So we want to make sure that it's the images, when you're working them in your mind, try to make them as realistic as possible. And then this camera is going to be internal. You're going to be seeing yourself from inside yourself looking out. But at some point, if you choose to be outside yourself and looking in, that's fine. Well, most of us are inside looking out. We are under control of this environment that we're going to create. We are able to make it be as positive and as beautiful as we possibly want it to be. We're going to be employing the points in our brain that use our senses. We're going to use sight and imagine smells and touch and taste. And we're really going to create some vivid image so that you can go back to this after you create it tonight. You're welcome to go back to a place you know, but you can start a whole new imagery if you want to. We're going to do it. We're going to take about 15 minutes to do this exercise, and I hope that's okay with people. It's 8 o'clock. And then we'll do a check-in afterward. So this exercise I'd like you to do is, if you are comfortable, you can keep your eyes open, but if you'd like to close your eyes, feel free to do so. I want you to imagine yourself being in a very peaceful and relaxing state. Begin with a few slow, deep breaths, in through your nose and out through your mouth. Let your body get relaxed. Let the chair fully support your body as you continue to breathe and relax. Now, if you're ready, use your imagination to picture yourself walking slowly along a path. It's a pleasant path, any kind that you wish. It's a beautiful day around you, and you feel relaxed and happy. You can feel the warmth and energy of the sunlight on your skin. Soon, you come to a gate. You know this gate leads to a special place where you feel welcomed, safe, and comfortable. Maybe there is a treasured pet there at the gate to greet you. Push the gate open and allow yourself to enter your very own private garden. Your garden is filled with your favorite things. Whatever is pleasing to you can be found in this place. Perhaps there are flowers, trees, birds, some water. Maybe there's an animal or two. Maybe there's music. Look around you and notice what is in your garden. See all the colors and objects that are in this place. Notice how beautiful they are. Look at the various shapes and see how varied they are. Look at the ground. Look up at the sky and see where they meet. Your garden is calm and tranquil. Everything peacefully coexists in this garden. As you are looking, become aware of how things might feel in this private place of yours. Begin to explore this place with your sense of touch. Perhaps some things are soft and warm, but others are cool and smooth. Simply spend some time exploring, using your imagination of your sense of touch as you continue to feel at peace and comfortable. Notice what the air feels like. Is it cool or warm? Is there a breeze? Or is it still? Soak up the peace and serenity in this private place. As you continue to explore your garden by seeing and feeling, become aware of the sounds that you hear in your garden. The sounds are pleasing to your ear and very comforting. Perhaps it's quiet in your garden, or maybe there are a number of sounds. Some of the sounds may be very soft, while others may be louder. Relax and listen for a while, and see if you can identify the different sounds in your garden. As you're listening to the sounds, become aware of what smells you might smell. Take a deep breath in. Notice the fragrances that are present. Some of them may be familiar, while others may not be familiar. The fragrances are all pleasing and soothing. Take your time and enjoy your visit in your garden. This garden is yours. You can always come back to it. When you are ready to leave, slowly walk back towards the gate of your garden. You've enjoyed your visit to the garden and you feel relaxed and content. This warmth and good feeling will remain with you through the remainder of the day. Push the gate open and return to the path that led you to the garden. As you make your way back up the path to the here and now, remember that you can use your imagination to return to this private garden at any time you wish. Visit your garden anytime you'd like to relax, to be comforted, or just to enjoy its beauty. You're now ready to resume your day. Gently breath, gently stretch. Take a deep breath and open your eyes, feeling refreshed and alert. Well, how did that feel? How did that go for you? Yes.
That was actually a really positive experience for me because
if ever someone is leaving a group and says, take yourself to your happy place, visualize your happy place. It's not something that I can sort of visualize, so I always go to my breath. But when it was specific like that, then I could create a happy place.
I'm so glad.
Yeah.
Mhm. You're welcome. So just for the sake of the audience, by being able to be led through the specifics of building the happy place, you actually had a happy place that you can see coming back to. Yes.
Another question, do you have any insight into, like, there's virtual reality these days, you can get the VR goggles or whatever, and you can watch whatever you want and you feel like you're actually in it. Do you have any insight into whether that would provide a similar experience or even better, because you can actually see everything rather than having to create an imagination? I don't know, I'm just
Would a
curious.
virtual reality experience of this be good? I imagine it would be, but I wouldn't want to have to rely on energy and technology and the internet. I like the fact this is homegrown and you can take it with you everywhere, anywhere, anytime. Because once you've got this constructed, it is a tool that you can take. It is always in your skill set. And this is one example of a happy place you've built here. VR wouldn't have as much adaptability, because the next time you could imagine walking down the path to the ocean, or you could imagine climbing the steps to a temple, or you could imagine some other way of walking, making it your very own. Yeah. Yes.
Thanks for everything you said. I really appreciate it.
Thank you.
In that visualization, I've done in my own meditations. You know, sometimes in the summertime, you're sitting there and the weather's perfect, the sky is blue, and this is just an absolute perfect moment. And you don't need anything. And so I visualize that, the sun coming over me, the warmth, and just the enjoyment of that. But I never once thought about visualizing the smells. And one of the things that I really miss in winter are the wonderful smells all summer long.
Yes.
You know, the spring, the flowers, and just the wonderful, wonderful smells. So I'm going to be able to, and I was doing that, and I could actually visualize the smells, which was quite incredible.
So to be able to visualize the smells is a new enhancement of your prior visualization before. Yes.
And I was thinking about the VR, and if I'm creating my own garden, VR could never create my own garden. And the sun and the smells and the birds and just really the dining.
Yeah. So I'm really glad that you found that, creating your own space and tuning it to your own vision, and then augmenting it by the addition of smell on top of what you had experienced. Great. Anybody else have any sort of feelings that this brought up for them?
I was just gonna say, similarly, I found kind of where the visualization led into the different senses, more powerful almost than actually being able to create an image of the place. I actually resonated more with the smell and the sounds of where my happy place is more sense-based, I think, than visually. So I found that, similar to what you said, very powerful in that, yeah, I have a hard time sometimes creating actual physical images and imagery, but the sensations I could recall as soon as you mentioned the smell and what can you hear and what can you feel. Those different sensations I found I was able to really build that happy place.
So it helped to have those verbal cues to help you enrich the environment and draw into play all the different senses.
And taking away from, I think, just being with your eyes.
Yeah.
I think that usually when I think of visualization, I try to see it in my mind as a picture, but yeah, those cues for different senses and found very engaging.
So this is more than visualization. This is actually kind of guided imagery. And it's a very effective tool, though, because you're employing all of those senses. it's an even stronger way of overriding and buying yourself space in your mind away from troubling thoughts. Or if you're in pain, create a safe place where you really envision the sunlight taking away the pain, washing it through into the earth below you. There's lots of ways that I have seen this used in other iterations. They're easy to find online, where there's guided visualizations like this imagery. Headspace has many. You can sign up for 40% off right now. Now that I'm promoting it, they're trying to, every time I was on there, it's like, really? I don't want you. I've had it before and I didn't like all the reminders. I found it too stressful. But there's Mindfulness University. There's an app store. Have you heard of that? Mindfulness U? Oh, well, there is. Where you can get all kinds of things. Part of the research I did was with Doug McLean, and he had a whole website of all of his recordings. Oh heavens, I use Insight Timer. It's free, and there's many guided, like there's thousands on Insight Timer for free. Yes.
Can't wait for the recording of this session.
Yeah.
Did you, your voice guiding us?
Yes, definitely.
Yeah.
Voice too.
Actually, like this first time being successful creating my own space. I would return that space for the next days.
That can be my next career, right? Just doing.
Just pre-record
I get teased about having a doctor voice, so did I put my doctor voice on for that? Yeah. Anyways, that's great. They're soothing. That's fantastic. But is there anybody that had any adverse reaction? Anybody that found it difficult?
I didn't want to leave. And they were like, it's time to walk out. I was like, not yet.
Okay. No, because I really do want to break it down. If there's anybody that found that was stressful. My idea, once when I did this before, it was the animal guide. Did anybody else, have you ever done a visualization where you imagine your favorite pet with you or treasured pet?
Oh, I've got it.
Oh, before you do that, did anybody find that troubling at all? Okay, because
No, but I found it troubling to leave him in the garden when I left, so I took him.
because I wondered about addressing that, because I was thinking, and I should have, because I had added that in and I was thinking, I didn't write the script in. You should say goodbye to your treasured friend and that you'll see them next time you come, because I'm going to put that in the script for the next time, because I think that it's important to have that. I had a dog when I was in Australia that was old, and I expected her to die while I was there. And this is where I really did a lot of meditation through a lot of wonderful stuff. But anyways, I always created my dog as my spiritual guide for my meditations down that path into the journey. And yeah, she still is, even though she's long dead. So thank you. Next time, say goodbye, close the gate, or take them with you. Is there anything else that anybody felt they wanted to share before you give us the story? Do you remember Doug McLean? Doug McLean did a lot of MBSR courses, and he actually did talks for us. And he worked with me on my master's research project, where we ran mindfulness seminars for family medicine residents and taught them an abbreviated form of mindfulness-based stress reduction. So he really helped me do that research. And unfortunately, he died, what was that, 3 years ago? Just before COVID. Yeah.
Was on an airplane, just getting ready to leave the airport. And Doug was supposed to present in 1 week here.
Yeah.
And unfortunately, he said he couldn't present because of his illness. So.
Yeah.
And Doug presented here. I don't know if anybody remembers, but he was very good.
Yeah,
We've
been going for 8 years. So I don't know if anybody else has been there. But he was one of our earlier speakers.
Yeah.
Okay.
Which one is your programs that you taught? Are there after the session? Is there similar ones you recommend available to people not in specific medical professions?
Well, I tell you what, let's take a tea break.
Yeah.
Well, we don't have time for a tea break. Oh, it's 8:17. Okay, no, I don't know.
Tea break after we finish.
Okay, all right. Is there resources for this? Well, yes, there is. When we post it, I will put, if you want to learn more about this course is actually online through the CMA Wellness Hub. and Stephanie Smith and our crew, we did a whole bunch of simulated scenarios using high fidelity medical situations in the lab, at the sim lab at the med school. And we did also with actors doing, 2 actors and medical students. And so we've done a whole bunch of scenarios. So on the CMA Wellness Hub, this whole course is there. If you care to go there, it's under Strive. If you just search for Strive under the CMA Wellness Hub. And I think we can put the link on, because I had sent you the link. I don't,
We posted it on,
it might be on the website.
it's on the resource section of the website.
That's
So
okay.
what you sent me.
Oh, yeah, that
So
link
it's
there.
There is the link on the website.
Yeah, but I found that there's a lot of work that's required in mounting the Strive course to coordinate all the preceptors, because every group has to have 2 facilitators to do the debrief properly, because they're quite stressful scenarios we put people through in order to make them really think in the moment and utilize these skills. And so it's labor intensive, it's costly. The medical school has to grant us access to it and the resources. So we offer them occasionally, but it's not something that is available outside of the medical school, the actual Strive course. Sorry.
Should we open up to questions?
Yes,
We have
any
time?
other general questions for Phil as well? Because, and if you really want to think, did anybody find that experience emotional as you went into that garden? I've cried when I've done that before because of just the feelings. Yes?
Mine changed, and I just found it really interesting, because what I was creating, and then, you get teary, and then I went to like a place, a cabin we had growing up, and I was like, of course I felt so at peace there, like just in the outdoors. And so it's interesting, so I'm like, that's my place. That's what I'm gonna go do next time, because it's, yeah, it just is interesting how it shifted.
That's such a wonderful thing, that this exercise reawakened in you the ability to go to that safe place in your mind. Did anybody else experience? Okay, it's a hockey puck. Did anyone, that scared us. Anybody else have any insights they'd like to share? Yes.
I just found it really took me to a place of gratitude. Like the whole thing was about gratitude for me. The time went really quickly. If that was 15 minutes, I'm not sure.
I didn't time it, might have been less.
But I know you were saying like the imagine. I don't think I imagined. Everything was just coming out of my, like things that have actually, I could feel and touch in my past. Like it's everything that came through for me has been very positive experiences for me, is what I felt.
So it enacted, or it engendered a feeling of gratitude inside you because of just the different ways that it made you think and feel.
And all the positive
things you were building in your
places and
mind.
things I've done and experienced.
So like kind of like a life. So it was really a comprehensive sort of
Yeah, and that's
life
where the gratitude
overview
came in.
of like the gratitude. How fortunate. That's really wonderful. Yes. Anybody else?
It was a bit similar for me. I like to travel, so I went to 2 different countries in the same visualization. And I'm like, okay, this is great. Very cheap travel. And it feels so good. I can go there whenever I want. But it was actual experiences that I've had, actual moments that I pictured I kind of tried, I followed what you were saying, but I also changed it a little bit. You said it's a garden, but I'm like, no, it's a beach. And then trees there and flowers, right? So I kind of used it to lead me a little bit, but changed it to match with where I wanted to be. And then I jumped from one place to another, and then now there's a waterfall. So, it was much like what the lady was saying there, it was real experiences that I had in the past which your guidance kind of helped me bring myself there.
So the guidance helped reawaken, help you relive those memories, and so you could be the architect of your own beautiful place that you can now, well, that's the greatest thing, because it's fluid, and one day you might want to go to the beach, and another day you want to climb a mountain, I mean, whatever. It just, the idea is that it's very helpful to have this play in our imagination to bring it back, because we don't use our imaginations as much as we could afford to. And so it's kind of neat to tap into that ability to create this tapestry of all of these different things. Yes.
When I opened the gate and stepped through, there was not a garden full of fragrant flowers and beautiful colors. It was a wasteland of chewed off stems and leaves lying on the grass. And so I lay down in the grass and quietly said, "Hey." And then this gang, this litter, this ensemble of 8 Cocker Spaniel puppies came on to me, and they were on my face, and they were trying to get into my slightly clenched pants where the treats were, and they were pulling on my belt buckle, and they were chewing on the toes of my shoes. And I just stayed in this wasteland of love until all 8 of them were sleeping. Then I quietly got up and had so much peace and gratitude walking slowly out the gate.
Well, that's a very novel take on it.
So Joan, we're coming to the end of the evening,
Yeah.
and I wondered if, no, it's still you.
Oh.
Me in a second, but you. And before we come to a close, I wondered if you could just summarize a few take-home points for our group.
Okay. Well, you've learned these skills are portable. You can do them here, in your imagination, in your body, sitting in a chair. You've practiced the arousal control through the tactical breathing. We've talked about SMART goal setting. We've talked about visualization. We've talked about, oh my goodness, I have to go back to my list. It's floating away from me. Go through, sorry, honey. Self-talk, the positive stuff, about to override the negatives and how we can focus on being able to be our own support. We've talked about, oh, we didn't do progressive muscle relaxation. Sorry, guys, no time for that right now. But that's another way of really bringing your mind into your body and helping calm your mind. You've probably all done that somewhere else too. Thank you for being an attentive audience and participating and sharing so much of your own perspectives.
So this has been an absolute delight. What a wonderful speaker, and Joan will be back again to present on something, who knows what. So I first of all, it was a delight. Thank you so much. So this will be recorded, and it'll be on the website within 1 week or sooner. Again, a tremendous gratitude for Joan coming here tonight and presenting, and she will be back. A reminder that, again, if you feel that this was of value for you, we would appreciate a donation to help support our group, and there's a basket back there. What's coming up? January 18th. Anybody know George McFall? So George McFall is a wonderful, experienced yogic teacher who's an expert in yoga nidra. And yoga nidra is a form of yogic sleep horizontal meditation. And so this will be here in 2 weeks, and the announcement will come out. And then on February the 1st, Phil Bluestein is going to talk. That's me. And I'm going to do a talk on what I believe is the essence of mindfulness and the essence of suffering. And that's what the Buddha talked about, the sense that we create a sense of self, we own it, we believe that it's real, and that is the key, and the segue to freedom is through non-identification with the self, and ultimately not even create it. So thank you all so much for showing up. There's one thing that we would ask. There's a red cart back there, and people who've been here before can help direct you, because we like to move the chairs out of here into the back. And if anybody would like us to help shut down the hall in the kitchen, I'll be back there. So thank you all very much, and particularly thank you, Joan.
You're welcome.